All right, I got my situation situated here. All right, you guys. So last week I think we pretty well reviewed the major muscle groups that we've covered so far: glutes, hamstrings, quads, adductors. So today we are going to venture below the knee. And a couple of things that we're going to talk about today. We're going to look at the bones and bony landmarks just to make sure that we're, again, familiar with kind of the geography of the area that we're talking about. First thing we're going to look at is the femur. Now, of particular importance to us now is the distal femur, now that we're down by the knee. So the two major landmarks that I really want us to know are, number one, the medial and lateral condyles. Now, the condyle is the bulbous portion on the distal posterior femur. I'll pull up my anatomy app and I'll show us the highlighted portions of the bone. But you can see right there on either side of the femur, those kind of large swellings on either side, those are the condyles. We can also highlight them like this. So you can see what specifically is highlighted there in green is just the articular cartilage. But then we see that portion there in purple, that whole swelling of bone, that's the condyle. We are also looking at these two kind of lines that arise on the superior aspect of both of those condyles. Those would be the medial and lateral supracondylar ridges. Medial and lateral supracondylar ridges. So we can see it there in pink. That would be the medial supracondylar ridge. And there is the lateral supracondylar ridge. Now, for whatever reason, don't ask me why, but this particular photo on the slideshow doesn't label those two landmarks, but you can clearly see the two ridges rising up on either side. All right, so our two condyles and our two supracondylar lines. Those are the landmarks on the femur. Next, we're going to look at the patella. Patella is a relatively simple bone. There's really not that much to it. The superior aspect is called the base. The main portion would be the body. And then the pointy portion on its inferior aspect is called the apex. That's the whole bone. That's it. Now, with the tibia and fibula. Along the proximal portion of the tibia, you have, again, these two large swellings. Those would be the medial and lateral condyles of the tibia. On the lateral side, you have the head of the fibula. Now, this is going to be a fibrous joint here, you guys. These two bones do not move relative to each other. They are locked together, and other than that, they do not move relative to one another. So those two bones will move together as a unit rather than one moving independently of the other. So that is an example of a fibrous joint, just like the sutures in your skull. It is a joint that does not move. On the anterior side, I'm sure at this point we should be familiar with the tibial tuberosity, the tibial tubercle, and the pes anserinus attachment site. Yes, those three landmarks should be old hat to us. Super. So let's move on to the posterior side. Even with all the coloring splotches on this bone, you should start to see that diagonal line formed on the posterior tibia. I will highlight it for you there. That is known as the soleal line, the soleal line. It is named the soleal line after the muscle that uses it as an origin point, which is the soleus muscle. And maybe one more. There is the soleus. So you'll notice this muscle, when I take the muscle off, it's originating along this soleal line on the posterior tibia. We have the shaft of the tibia, shaft of the fibula. And then as we move down to the inferior aspect, you'll notice in anatomical position, the tibia will have a little bit of an overhang on the medial side. So a little bit of the tibia, almost like a melted candle, just kind of melts off and over to the side. That landmark is the medial malleolus. Yeah, highlighted for you there. And so this is an easy way, guys, that you always know which side is medial. That overhang on the tibia will always point medial. So if you ever just handed a tibia and asked, is this a left tibia or a right tibia? The overhang is always medial. So that's one of the tricks you can use to tell which side you're looking at. The distal part of the fibula, the entire distal epiphysis is called the lateral malleolus. It doesn't matter whether you're on a left or a right fibula. The whole distal epiphysis is always going to be called the lateral malleolus. Good stuff so far. Good stuff. Yeah, I know this is fascinating. All right. Oh, one more little thing. If we notice how the fibula and the tibia are smushed together at the bottom side, when I take away the fibula, you notice the tibia has a notch right there. That is the fibular notch. It's the notch for the fibula, fibular notch. All right, so the primary landmarks that I want us to focus on, medial and lateral malleolus and the soleal line, which is also called the popliteal line because everything in anatomy has 4 different names and we all just have to die mad about it. Popliteal line or soleal line. Again, both of those names are referring to muscles that use that line as an origin point. So we can call it the soleal line in reference to the soleus, or we can call it the popliteal line in reference to the popliteus muscle. Either way, you're talking about the same thing. Now, looking at the foot, we've got our tarsal bones color-coded here. So even though you're looking at the superior view, I want you guys to know that the talus is the one that is the most superior. It is the one that sits on top. Talus is the bone that articulates with the tibia and the fibula. It is the only one that makes that joint. Talus touches the tibia and fibula. Inferior to or below the talus, then you have the calcaneus, the heel bone. That is not only the largest bone in the foot, it is also the largest short bone in the body. It's pretty big. Now, moving on towards the toes, the next bone you have is the navicular. And this one is the one that this one is where I get a little goofy, because if you look at the shape of that bone, you see how it somewhat kind of resembles like a little crescent moon, right? I would say, come on, screen. So you've got the navicular bone, which is generally shaped like this. And when I think of that, I think of like a little canoe or like a little boat. And when I think of boats, I think of the Navy. In the Navy, we were sailing all day in the Navy. Anyway, on the boat, stowed away underboard are 3 stowaway cubins. Those are the cuboids, right? The medial, intermediate, and lateral cuboids. And then the bone off to the side, I'm sorry, not cuboids, cuneiforms. That's what I meant to say. I totally meant to say cuneiforms, guys. And then the bone on the lateral side, that's the cuboid, just one. So we've got our blue navicular, our red stowaway cuneiforms underneath the boat, and then the green cuboid on the lateral side of the foot. The next array of bones are the metatarsals and then our phalanges. Good stuff. Good stuff. Never totally consume curdled milk. Never totally consume never totally consume curdled milk, is the mnemonic I use to remember the names of them all. You have navicular, talus, calcaneus, cuboid, and then the middle, intermediate, and lateral cuneiforms. So other foot structures. Yes, there are other foot structures, believe it or not. So we have several retinaculums. We'll recall a retinaculum is just a thin sheet of dense connective tissue that will be wrapped around a joint just to hold all of those tendons nice and close to the joint. We have them in the wrist, we have them in the ankles. You can think of them almost like little sandal straps, the way that kind of wrap and twist around the ankle. So we have the extensor retinaculum, the peroneal retinaculum, and the flexor retinaculum. And again, if we take a moment to just kind of ponder those names, the names are cluing you in as to what's going on. The flexor retinaculum will be located on the posterior ankle. We'll recall when the heel moves upward, right? When the heel moves upwards, that's not what I'm trying to do. When the heel moves upwards, the toes go down. We call that movement plantar flexion. Plantar flexion. So the flexor retinaculum is on the posterior side. We will also recall that when the toe or when the heel rolls downward, the toes move upward. We call that dorsiflexion. I may have gone on my whole rant with you guys about why dorsiflexion isn't a real thing. That was just my little opinion. Yeah. So with dorsiflexion, remember we're actually looking at an extension movement. So the extensor retinaculum is on the anterior side. And then if you'll also remember the peroneal muscle, which is on the lateral side of the leg, there is the peroneal retinaculum on the lateral side. Good stuff so far? Names making sense to us? Super. Super, super, super. So the plantar fascia is another major structure. The plantar fascia is a dense group of fascia that is going to be on the plantar surface on the underside of the foot. This is the same structure that's going to be responsible for plantar fasciitis. And let me figure out how to open up a new tab on here. I know there's a way for me to do a new tab. It doesn't let me erase what I've drawn super easily. And I'm sorry, I know it's frustrating. Believe me, it's frustrating. See, I hit undo and then it just keeps putting the drawing back on. So I hit undo again and then it puts the drawing back on. Okay. So the area of interest right now is going to be the medial side of the ankle, posterior to the medial malleolus. So right in here, right on top of the medial malleolus, you'll notice that little green blob, that's a bursa. That's a bursa. Posterior to the medial malleolus, we have several structures that are hooked around that portion of the fibula. It's using it almost like a pulley, so that these like cable-like structures are kind of wrapped around this post, and then they go down into the foot, and they're using it like a hinge or something, so that as the muscle above pulls, the foot is swung around its hinge, right? So the three major structures that are packed there are the tendon for the flexor digitorum longus muscle, the posterior tibial artery, the tibial nerve, the flexor hallucis longus tendon, the tibialis posterior tendon. So what they usually do is they use the phrase like Tom, Dick, and Harry, and it's tibialis posterior, digitorum longus, and hallucis longus names the tendons, Tom, Dick, and Harry. Tibialis, digitorum, hallucis. But Tom, Dick, and Harry are also bloody nervous because there's the tibial artery and the tibial nerve, bloody nervous. And here we can see what I was talking about. So this bone is the medial malleolus, and we notice we have a whole bundle of material just posterior to it. Starting first, we have our T for Tom, tibialis posterior tendon. After Tom, we have Dick, that's our flexor digitorum longus tendon. Then the tibial artery. Then the tibial, there it is, tibial nerve. And finally, Harry, flexor hallucis longus muscle tendon. Tom, Dick, and bloody nervous Harry. Okay, so here's your descriptions of the retinacula. We've talked about these already. I'm not going to spend too much time on these. We know what they are. We know where they are. We can move right along. All right, plantar fascia. Let me pull this one up as well. Looking at the underside of the foot, you can see this extremely broad, very strong strip of connective tissue. This would be the plantar aponeurosis or the plantar fascia. So this is the deal when you're looking at someone with something like plantar fasciitis, is that the connective tissue is too tight. So it's pulling the foot, it's into a shortened position. So what's happening is it's going to increase the arch, right? And that's going to create a lot of pain. Usually it's caused by just not wearing like proper shoes or like proper, or like getting proper support with your shoes. So most of this stuff can be corrected through, you know, orthotic inserts and massage and stretching and things like that. But again, some people actually allow it to progress much, much worse, or it could be complicated by other diseases like neuropathy, diabetes, things like that. But generally speaking, plantar fasciitis is a chronic kind of an overuse thing. If we take the normal steps of like massage, loosen it up, stretch it out, and then put some inserts in those shoes to actually give the foot some structural support, we can usually make some headway with plantar fasciitis. And the posterior tibial artery, distal and posterior to the medial malleolus. We talked about this one already. All right, joints. Major joint we're looking at is the knee joint, tibiofemoral joint. Other major joints that we are looking at is the distal tibiofibular joint. Again, that's a fibrous joint. It does not move. The talocrural joint is the joint between the talus below and the tibia above. This is the joint that you think of when you are thinking of your ankle joint. This is the joint that allows dorsiflexion and plantar flexion, this hinge movement of the foot. This is the only joint where that motion occurs. Plantar flexion, dorsiflexion happens at this joint. The next joint below is the joint between the talus and the calcaneus. That is known as the subtalar joint, the joint below the talus. The joint between the talus and the calcaneus is what allows inversion, eversion. So this allows the lateral movement of the foot. This is a separate joint from the tibiotalar joint, which allows dorsiflexion, plantar flexion. Cool. The other 5 tarsal bones all articulate together, the navicular, the cuboid, the cuneiforms. Those will all be gliding joints. So they allow movement along the plane, but they don't allow like an insane amount of movement. Those kind of movements will just assist with inversion and eversion, maybe getting the last few degrees range of motion out of the foot. And so ankle movements, we have plantar flexion and dorsiflexion. Plantar flexion is pushing down on the gas pedal. Dorsiflexion is lifting up on the gas pedal. Please pay no mind to this illustration. Do not ask me why they decided to go with flexion versus extension. Again, nobody asked my opinion on these things. I'm just saying. Inversion, eversion. With inversion, the big toe moves in. With eversion, the little toe exits, right? You could also think of your little monkey feet holding the soup or pouring the soup out. One more detail that I will give you. I did not make the slideshow. This picture has it backwards. Those words are flipped. It is wrong. Don't ask me why, but that's a mistake. Please pay attention. The picture says pronation, the sole faces in, that is backwards. With pronation, the sole is facing outwards. With supination, you are holding the soup, the soles of the foot are faced inwards. Capiche? Capiche, awesome. All right, toe extension and toe flexion. Curling the toes under, like making a little fist, is flexion. Raising the toes up, like you're trying to give someone a little foot high five, toe extension. Plantar fasciitis. Again, we talked about plantar fasciitis, guys. I'm gonna move happily along. Femoral triangle. Again, we've talked about the femoral triangle. We know what's there. We're gonna move right along. Okay, on to our business of the day. We have 4 major muscles that we are going to cover today. The first is the gastrocnemius, often just called the gastrocs. It's a pretty unique muscle. Its origin is the posterior condyles of the femur. So it begins on the posterior side of the femur, above the knee. Clue number 1. Its insertion is on the calcaneus via the calcaneal tendon or the Achilles tendon. So it inserts on the foot. Clue number 2. It's crossing the knee on the backside and it's crossing the heel on the backside. So when we think about what kind of actions this muscle might perform, if it's crossing the knee, if it's crossing the knee on the posterior side, now that we're past the hip, posterior knee muscles flex. Now we are in flexors on the backside. So since it crosses the knee on the back, it flexes the knee. It crosses the ankle there at its tendon on the posterior side. When the muscle shortens, it will pull up on the heel, which will cause the toes to drop downwards. It's a dorsiflexor. Good stuff? Knee flexor, dorsiflexor of the ankle. Olivia, you good?
Isn't it plantar flexion? Because dorsiflexion is like this.
Yes. It is, you're right. I used the wrong word.
Okay.
I only had 1 cup of coffee this morning, sorry. No, you're totally right. I only had 1 cup of coffee this morning, sorry.
Okay.
Yeah. So we can see almost like a hydraulic action. When the muscle shortens, it pulls up on the heel, which causes the toes to drop down. That is, thank you, Olivia, plantar flexion. My app does not show its other action. However, looking at the gastrocnemius, we can see it's beginning up on the femur. So when the muscle contracts, it will pull the heel toward the femur. That will be knee flexion. It will bend the knee. Now the gastroc also has this kind of unique double belly, which is, again, something we don't really see very often. But despite the two bellies, it is in fact one muscle. There's not like a minor or a major. The two bellies contract together. The two bellies of the muscle function as one. So it's just one muscle. So we've got its origin on the posterior condyles of the femur. We have its insertion on the calcaneus via the Achilles tendon. And we've basically inferred the two actions that this muscle can perform: knee flexion, plantar flexion of the ankle. Good stuff. Good stuff. Now, the next muscle is its buddy soleus. Soleus is going to be a synergist to the gastrocnemius. They perform the same action. The soleus originates along the soleal line on the posterior tibia. So please pay attention. It starts on the tibia, not the femur. So it does not cross the knee. So this muscle has nothing to do with knee movement. The soleus is a plantar flexor. It becomes the same Achilles tendon as the gastroc. So if you follow me here, we've got the gastroc highlighted, then we have the Achilles tendon highlighted. You'll notice the soleus there. Its tendon and the Achilles tendon blend to become one. So it inserts at the exact same spot on the calcaneus via the calcaneal tendon. Since it's crossing the ankle on the posterior side, it is also a plantar flexor, just like its buddy gastrocnemius. Origin, soleal line and proximal tibia. Insertion, calcaneus via calcaneal tendon. Action, plantar flexion of the talocrural joint. Now, I wanted to pause for a moment. So when you have the gastrocnemius and the soleus muscles together, since you've got two heads on the gastroc and then one head on the soleus, we are looking at a tricep muscle. This particular one is called the triceps surae. So I just want to be clear. The triceps surae is a name that we give to two muscles together, the gastroc and the soleus together. When we refer to them together, we refer to them as the triceps surae, the three-headed muscle of the sural region. I don't know how much into body regions you guys go, but when we talk about body regions, the region of the anterior calf, right, your shin, where soccer players would wear shin guards, that is the crural region, The sural region is what you think of as the calf, the backside, where you look at all their fancy calf muscles, right? When you're checking out someone's calves, you're looking at the sural region. So the triceps surae, the three-headed muscle in the sural region on the posterior side. The triceps surae are also known as your second heart because of the important role that they play in returning blood from the lower leg back up the leg. We will recall when it comes to blood circulation, the arteries have blood pressure from the heart that is pushing the blood along. But once blood gets down to the level of a capillary, there is no more blood pressure at all. So when the blood is recollected in the veins, we need another mechanism for keeping the blood circulating in one direction. We're aware veins have one-way valves, which keep blood moving only in one direction. But how do we get the blood against gravity from the feet and the ankles and get that blood all the way up the leg? The vast majority of this, we are relying on contractions from the triceps surae, the gastroc and the soleus together. That is responsible for getting the vast majority of the blood from the very distal extremity moving back up the leg. This is why, you guys, when we're looking at people who are really out of shape, or you're looking at elderly people who are trying to start, getting a little activity in, what is the number one thing that they recommend people do? Walk. Just walk. Put weight on your feet and move them around. That is why walking is so good for circulation. This is why getting old people to just go for a walk around the block, why that helps with their circulation, all of that stuff. So my point here is I just wanted to pull a little bit of attention to this muscle pair and let you know there is another name for them, and they have a really important kind of side function, which is they greatly assist with leg circulation. I'd give real money if this PowerPoint would stay in the same spot that I leave it. That would just be awesome, but it would make my life way too easy. All right, so gastrocnemius, soleus muscles, super important. They work together not only to, plantar flex the ankle, but super key role in leg circulation. The next muscle we're going to look at is plantaris. And again, this muscle has a name that's kind of cluing you in a little bit, at least I like to think so. If you think about the plantaris muscle, I'm going to find it on the back of the knee. There it is. Check out this little muscle. Do you notice how almost like a flower bud, it's got a long stem and then a short little belly? It looks like a little flower bud that just hasn't quite opened yet. Since it looks like a plant, plantaris. The muscle starts on the lateral supracondylar line of the femur. It cuts from lateral to medial, kind of diagonally across the back of the knee, and then it becomes a super thin little tendon. This guy is notable. That is the longest tendon in the body. That's the longest tendon you got. It runs just below the knee all the way to the ankle. And check this out, guys. It inserts on the calcaneus via the calcaneal tendon. Did anyone else just hear a red alert bell go off in their head? Did anyone else just hear that? I feel like it's like battle stations on the Enterprise here. The calcaneal tendon, we've just listed 3 separate muscles, all of whom insert on the calcaneus via the same tendon, which means they all join to become the same structure. Gastroc, soleus, plantaris. I would definitely make sure that I was fully aware of the muscles that form the calcaneal tendon. Just saying. Just saying. So let's look at popliteus a little deeper. If I could stay on it, that would be awesome. Plantaris, starting at the lateral supracondylar line of the femur, inserting on the calcaneus via the Achilles tendon, noting the muscle belly is on the posterior knee. And that tells me it's going to flex the knee. Since it crosses the back of the ankle, that tells me it's going to be a plantar flexor of the ankle, just like its big brother, gastrocnemius. But, and here's the but, look at gastrocnemius versus plantaris. There's your little plantaris muscle. There's the gastrocnemius. You see the size difference between those two? Gastrocnemius is your Batman. I'm sorry, but plantaris will never be anything but a robin. It is a synergist. It is a weak flexor of the knee. So maybe if you had ankle weights on and you were like flexing your knee against resistance, or you're using one of those resistance machines where you're flexing your knee against those like elastic bands, then for sure this guy is getting involved. But if you were just showing me the action in class and you stand up at your desk and just flex your knee, gastrocnemius is more than capable of handling that kind of thing by itself. Gastroc will be your prime mover. Plantaris is just going to be a robin. Sorry about your life. All right, so it's a weak knee flexor and a weak plantar flexor. Again, you don't get to save Gotham City being that big. Sorry about it. All right, after plantaris, last muscle of the day, popliteus. Popliteus, origin, lateral condyle of the femur, insertion, proximal posterior aspect of the tibia. So this is another muscle that is crossing diagonally across the knee from lateral to medial. Since it's crossing the back of the knee, that tells me it's going to be a knee flexor. But also, since that muscle is just a little teeny tiny little thing, that also tells me it is just a synergist. It would be a weak flexor. It is not going to be super involved in that kind of action. Looking at the positioning of this muscle, we can also notice how that broad fiber, the broad insertion of the muscle, when it contracts, it will pull the tibia medially, right? It will rotate the tibia medially. But its number one claim to fame, and the reason why popliteus is important enough that we talk about it in massage classes. When you are standing up straight with your knees locked, right? Your legs are hyperextended. This muscle must contract first to pop the lock on a flexed knee. Popliteus is the pop lock. And normally in class, I do the whole routine. Pop, lock, and drop it. Pop, lock, and drop it. Pop, lock, and drop it. But what we are saying is, bam, there's this muscle. When you are standing up straight and you really engage your quads and you lock your knees, remember, you're not supposed to stand that way. It'll make you pass out in the long run. Remember that. So when you realize you're about to pass out and you have to bend the knees, popliteus contracts first. It pops the lock, creating the first tiny bit of flexion in that joint, and then Batman takes over. Gastrocnemius and hamstrings take over, and they actually bend the knee. But popliteus contracts first. So it pops the lock. So we say it unlocks or initiates flexion of the extended knee. If the knee is already slightly flexed, then popliteus stays a robin. Its only claim to fame is when the knee is fully extended. Then it is the first thing to contract. Other than that, guys, it's a synergist. And with that, flexion of the knee, medial rotation of the knee, initiates flexion of the extended knee. I would argue that's less an action and more of like a keynote about it, right? Sartorius is the longest, latissimus dorsi is the broadest, popliteus isn't the most of anything, but it goes first with knee flexion. That's its thing. Okay, so I know that the little POW symbol thing here tells you that there's 3 actions, but just understand flexion of the knee, that's its action. Medial rotation also, but flexion of the knee is its action. Its claim to fame is that it just does it first. That's all. Cool. So read through the trail guide. You'll notice there's a blurb in the trail guide about the triceps surae that I went on to today. Muscle cards due for this week, we covered 4 muscles: gastroc, soleus, popliteus, plantaris. Do we have any questions over what we've covered so far today?
I actually have a question, Dave.
Yeah.
So I have a friend who has plantar fasciitis, and like you said, like massage is really helpful and everything. And I talked to him about like doing myofascial release with a lacrosse ball or something, and he's
Yes.
like, "Oh, it hurts so bad, I can't do it." And I'm wondering if that's the case. Like, should he not do it, or does that mean he really needs it?
Well, the grit your teeth and bear it massage therapist in me says, yeah, I know it hurts, but you need to do it anyway.
Mm-hmm.
However, you have to meet clients where they are. And if the treatment for the condition is so painful that they can't bear it, then forcing them to endure the treatment isn't going to have the therapeutic result you're looking for, right? As they're bearing it, their sympathetic system is getting activated. So they're going into fight or flight mode on that table, just trying to stay like contained. So what I would recommend is maybe using a numbing product on the foot first, maybe to do like a topical analgesic type thing, or what a lot of dancers do, because you can imagine the hell that dancers have to go through with their feet. You get a thick glass Coke bottle and you put it in the freezer, empty, of course. Put it in the freezer, and then you take it out and put it on the floor and you roll your foot over it.
Oh, okay. Got it.
But the other thing that he could be doing, though, are just simple stretches, right? So the kind of stretch where you put your foot out behind you and you curl your toes under and you push the heel down and really like try to stretch the whole plantar surface of the foot. So maybe coming into a lunge where you're actively stretching the back leg and like, again, curl the toes under, pin them to the floor, and then try to push the heel down as far as you can and try to get some length in there. For massage, I like to use forearms on the foot, forearms and elbows. So have them lay face down and you sit on the table and kind of put their foot right on the top of your thigh. And now I can just drop my elbow right on the plantar surface and just strip heel to toe, heel to toe. If you guys have taken reflexology, you may recall on the sole of the foot, there are those reflex zones. Now, for reflexology, it's one thing, but with general massage, those reflex zones line up with the bones of the foot. So if you follow like the line of the big toe, right, from the big toe to the heel, and then from the second toe to the heel, it matches these tendons and it matches the bones. So think about that. Imagine sinking your elbow right into the heel and then following that line out to the ball of the big toe. And then you reset your elbow and then you strip out to the second toe and then the third toe and then the fourth toe and then the fifth toe. And then you curl the toes back and stretch. Use your ulna from heel to toe, roll the tissue out, right? Flatten it out. Do you see where I'm going with this? And just generally like try to work the tissue, stretch it, let it fill up with fresh fluid, push the old fluid out. Stretch it, work it, let it fill up with fresh fluid, do it again, flush all that fluid out. You want to just keep influxing it with bright red oxygenated arterial blood. And then again, stretch, stretch, stretch. That's the whole point is of loosening it up, is so that we can then stretch it. I also highly recommend he go pay a visit to Dr. Scholl. And maybe sit on one of those machines where you stand on the thing and it scans your feet and it tells you exactly, like, they're color coded and labeled and everything, so that it'll look at you stand and it will tell you exactly what insert to buy. But without some kind of structural support, it's just going to get worse. Like every other kind of chronic injury, guys, like any other kind of chronic injury, where you're talking about runner's knee or tennis elbow, if they don't do anything to treat it, it's just going to get worse. So anyone else? Good questions. All right, then. If we don't have any more questions, then I have a question for you. Somebody, please, name the 4 muscles that we have covered today.
gastrocnemius, popliteus, plantaris, and soleus.
Very good. All right, my first question. Which of these muscles go together? Let me ask another way. When you look at these 4 muscles, which muscle doesn't belong? You guys are muted, I can't hear you.
Popliteus.
Why?
The other 3 have the same insertion.
Nailed it. What is that insertion?
The calcaneus via Achilles tendon.
Excellent. That is exactly what I wanted. That's C-A-L-C, calc, and then A-C-H, Achilles. I'm just abbreviating here, you guys, sorry. Awesome. Of these muscles, which of them flex the knee?
Gastroc.
The soleus.
No,
And
soleus does not flex the
doesn't?
knee.
Oh, that's right. Okay.
Which muscles flex the knee?
Plantaris. No, sorry, popliteus, I mean.
Plantaris is a weak knee flexor. It's on the back of the knee. And popliteus. So the only muscle that we've talked about today that does not flex the knee is the soleus. Why does the soleus not flex the knee?
Because it originates on the soleal line, which is below the knee.
Fantastic. Fantastic. So if it doesn't cross the knee, then what action does the soleus perform? Brianna, I read your lips. You're muted.
Yeah, plantar flexion.
Very good. What is the origin of the gastrocnemius?
The condyles of the femur. Medial and lateral.
Medial and lateral condyles of the femur. Fantastic. Fantastic. The only thing that we're missing for gastrocnemius is one of its actions. What was that other action of the gastrocnemius? It flexes the knee and one more thing.
Plantar flexion.
Yeah.
Plantar flexion. Excellent. What is the origin of plantaris?
The lateral supracondylar line of the femur. Does that just mean it's above the condyle? Supracondylar?
Yes. Yes. That is what that means. So we'll look at the posterior knee. We'll look at the right side. Let me throw in some color codes here. There in purple, that's the lateral condyle. And now there, above the condyle, is the lateral supracondylar ridge. That's where this muscle begins. Okay. Just so that we're aware, just so as you know. The medial and lateral supracondylar ridges, once they come together, we change their name into the linea aspera, the medial lateral lips of the linea aspera. It's the same line. Again, we just draw a dotted line and change the name. And then one more little detail, So upon the lateral condyle, on the lateral side, right there is a little bump. That is the lateral epicondyle. I just want to make that distinction. The condyle is the entire swelling of bone. The epicondyle is the bump upon the condyle, the bump on the swelling. Just want to make the distinction. Condyle and epicondyle are not referring to the same things. Just want to be clear. There are muscles that originate on the lateral epicondyle of the femur, and that's why I want to be clear. Okay, so we've got the lateral supracondylar line of the femur, insertion on the calcaneus, it flexes the knee. What else does it do? Plantaris. If it inserts,
Inversion. Is it inversion
inserts-
or eversion?
not inversion, it inserts on the heel, on the calcaneus.
Plantar flexion.
Plantar flexion. Yep. Yep. Do you remember, guys, last week when we were saying adductor magnus, because it shares an origin with the hamstrings, it's an honorary hamstring, so it gets to do one of those actions, which was hip extension. And then we said that the what was it? Gracilis inserts at pes anserinus, just like sartorius. So it also medially rotates the flex knee because it shares an insertion. It gets one of those actions. I just want to point out that same pattern here, you guys. We have an insertion on the Achilles, insertion on the Achilles, insertion on the Achilles. And for all of those, we have plantar flexion. So if it inserts on the heel, it's through the Achilles tendon, it's going to be a plantar flexor. Good stuff. Good stuff. All right, last thing to fill out. I think we got everything except popliteus. All right, so we know popliteus is a knee flexor. Who can tell me something else about popliteus? Either an origin, an insertion, or another action, maybe.
Lateral rotation.
Is it lateral
Or medial?
rotation? Medial rotation.
Okay.
Medially rotates the knee. What's its origin?
Lateral condyle of the femur.
Lateral condyle of the femur, and its insertion.
Tibial tuberosity, just a guess.
Good guess, but no. This one is a little difficult because it doesn't have like a clear bony landmark. So here we see popliteus, and the way we would simply describe is the proximal posterior medial shaft of the tibia. Proximal posterior medial shaft of the tibia. Let me see if I can go back to, yeah, proximal posterior aspect of the tibia. and it flexes the knee, immediately rotates the knee. And what was the other thing about popliteus that was important for us to know?
When the leg is in a locked position, it's the first one to pop off and then the knee.
That's supposed to be a little lock. That's what that's supposed to be. Pops the lock. There we have it, folks. There's our muscles for this week. Feeling pretty good, not too overwhelming, good stuff.
Good stuff. I had a quick question though with the Solaris. If it's so small and almost insignificant, why are we learning about it?
With soleus,
Soleus, yes.
soleus is not insignificant. No, soleus is super significant. Remember, gastrocnemius and soleus are your triceps surae. And despite the fact that gastroc is superficial and therefore it's the one you see, soleus is bigger than gastroc.
Oh wow. Okay.
Soleus is thick, bro. Yeah, soleus is THICC, bro. Thick. The issue with that muscle is gastroc sits superficial to it. Gastroc is the one that you really see, and all the other muscles of the leg kind of drown out just how big and powerful soleus is. So let me pull up the rest of the muscles. Yeah, when you're looking at the back of the leg, gastrocs are the ones that you really notice, right? But when you take soleus by itself, I mean, look how thick that muscle is.
Okay, now I see
It's
it.
broad from edge to edge of the leg. So when you look at the lateral leg, you're only seeing that thin little edge of the belly of the soleus. And then again, on the medial side, there is the soleus. It's the large bulge on the medial side of the tibia.
Okay.
So again, it's easy to overlook it, right? Or you see one bulge on one side and the other bulge on the other side of the leg, and we just kind of assume that those are two different muscles. That's the same muscle, bro. It's big. Yeah, gastroc and soleus are super important.
Okay, yeah,
Now-
from the lateral side, the view, it threw me off because I think that was the only time I looked down when I was driving. Anyways, cool.
Yeah.
All
Now,
right.
the other two, plantaris and popliteus, yes, they are small muscles, but they are still important, right? Popliteus, because it pops the locked knee, and plantaris, because it's one of the three muscles that form the Achilles tendon. So again, even though these muscles are small, and again, they are going to be Robins, they're not going to be Batmen in terms of movement, but there is something distinctive and notable about them. So we do want to take the time to get to know these guys, because these guys can just be just as responsible for other problems as well. Good stuff.
Yeah, so how do you get into the soleus then? It's just you gotta like compression and friction, or
Compression for one, and for two, the way you palpate the muscle is usually by palpating its edges. And since this muscle is a plantar flexor and gastroc is not, I'm sorry, gastroc is a knee flexor, then you lay your client face down and have them point the toes, but keep the knee straight. And that will keep some slack in the gastrocs so you can palpate through them and feel kind of like the basement underneath, which is the soleus. We'll get some hands-on in class later this week. It'll be fun. Wear shorts, you guys, because we're doing all calf muscles, so just wear shorts. All right, good stuff, guys. Any more questions? All righty. Well, this has been fun. You guys enjoy the rest of your day, and I will see you all on Thursday.
thank you later.
Thank you.
My pleasure. Have a good one, guys.